Hi, my name is Hannah Grebner,
And my name's Emily Brokaw.
and we are the two quality committee members from 3 South in Bismarck for the orthopedic floor. And our project this year was called Don't Fumble the Handoff, Improving Patient Safety on 3 South During Shift Change through SBAR. And we had some help from our director, Rick Lands, Julie Klindworth, and Cheryl Wynn that helped us out on this. So some background on our project, as you can follow along on the PowerPoint and the poster, that every floor has their own way of doing a shift change. On our floor, we get a patient assignment sheet that has all the patient's names, who you're assigned to, your nurse, your RN, and that is done twice a day for each shift, and that's assigned to them. Information about them, our old ones were just if they were isolation and expected discharge. And then also our second project that we worked on was the SMART phrase, or as we call it, the DOT phrase on the floor. And that is the patient's Cardex that tells them what is the situation going on with the patient, why they're here, and we upgraded that to the SBAR to be more SBAR friendly. We evaluated the data by looking at surveys, looking at data from patient injuries, falls, and happies. We incorporated the Plan, Do, Study, Act, and also the SBAR has been demonstrated use as a safe skill. This is just in the PowerPoint, just shows an email that we all get regarding SBAR and its importance and how it is helpful in giving a clear communication of what's going on with your patient. And like I said, our objective was evaluating 3 Southeast nursing staff surveys and comparing them to the data from last year compared to this year from the month of September of 2020 when we implemented it, to see if there were increased nurse satisfaction and decreased patient injuries, falls, and happies. And a list here is just all the actions we've taken, meetings and things like that we have done throughout to get to this point. Also, the next picture listed is just what our old patient assignment sheet looked like, how it just had isolation and discharge. We started out revamping it with doing a lot of information, and that did not go over as well with everyone. It was too busy, too much information. So we ended up just doing this last one here. That's the final one that we're using currently, that has isolation, which is important. If we have a kidney transplant, we need to make sure to keep them clean. Bed alarms, so that somebody can come up right away and see whether or not a patient is confused, and if they're checking on them, they should be checking on them first. Dialysis, it's good because you have to give them a bath at night, and nurses to plan their day because they go early. NPO for procedure, to make sure we're looking ahead and seeing what they're having done and whether or not they're being expected to be discharged. And then the next one is our DOT phrase, or the SMART phrase, that we include with every patient for the nurses, and those are printed off for them. The original one is very similar, but the second one is spelled out in SBAR form with some more extra information, and we kind of took from 2 South and 4 South and took in the SBAR to finalize it and make sure that we are giving a clean, concise, effective report on our patients. Some data that is shown is that the falls and happies, we have had 1 less each month from the month before. So in September we had 1 fall and 1 happy less than in August of 2020. Which is good. However, we've been kind of all over the place, and it's a little too early to make any decisions on the data on that. Hopefully it keeps trending down, but the data will show in the next few months whether or not this is working. Also, this is just from our nurse and CNA surveys, whether or not they have liked these things, if they didn't care, or if they thought that it wasn't really working. And over 50% of the people, 55%, so a little over half, feel that they're working and improving communication, and they feel that 70% feel that it's making safety a priority. There are some that think it hasn't really changed yet, so we're looking to probably change them in the future, maybe take out the dialysis part of it and see what goes from there. Basically, the analysis of it is that it's too early to tell, but we are trending down from 1 month, but on average we are 1 less a month too, based on the data from the last 3 months. But overall it's too premature to determine the assumption. Hopefully it keeps going down, but that's how we measured everything. And then some lessons learned, just having some nursing compliance. It's difficult to get nurses to change their daily routine, whether or not they're even though it was minimal changes, at some things it's hard to get nurses to do that. So just education, also having more data on and trending. So we should have started it earlier. So hopefully next year they can continue and see a difference. And measuring the data would be nice to have a more like quantitative, measurable outcome versus just our surveys. So in conclusion, just it's too soon to tell, but safety and falls and less happies are a priority for us, and we're hoping that with this new dot phrase and new patient assignment sheets that it will keep trending downward so that the patient's safety is the priority. And also we can spread this information through a symposium, UBC's nurse residency, and maybe people will take ideas from our dot phrases and patient assignment sheets and use them for other ones. So, and that's the end. Thank you.